So I'm a dental hygienist and I just finished my own teeth straightening journey with clear aligners. And honestly, I had no idea what to expect. I thought I did. I work with patients every day who have clear aligners, but going through the process myself was a whole different experience. There are so many little things you just don't fully understand until you actually live it. So in this video, I'm sharing my top tips, tricks, and experience as a patient, someone who went through it, covering all the things I wish I had known before starting my teeth straightening journey. And hopefully this will help make yours easier. Hi again, officially introducing myself. My name is Whitney and I'm a registered dental hygienist, but today I'm talking to you as a fellow dental patient, a person who goes to the dentist, and we're going to talk about my clear aligner teeth straightening journey. By the way, lots of people say Invisalign, but just know there are different brands that your dentist may use. There's ClearCorrect, SureSmile, and a few more. It's kind of like Kleenex and tissue. We tend to call all tissue Kleenex, even when we're not using the brand name Kleenex. Anyway, I'm trying to stick with the terminology of clear aligners in this video for that purpose. Now, let's start with things that I would recommend you buy ahead of time before you get your clear aligners. Because listen, I had braces as a kid, but for me, I do not remember braces being that uncomfortable. I don't know if it was the kid complex, like when you're swimming in freezing cold pool water as a kid, you don't realize it because you're just having so much fun swimming, but now as an adult, I feel that cold water, you know. Or is it really because of the way my teeth had to move this time? It was actually more uncomfortable? I don't know. I'm not an orthodontist, I'm a dental hygienist. But what I do know is, in the chance that you also have the extreme discomfort that I had the first few days of each tray. Okay, my teeth hurt. I can't show my teeth right now because they hurt so bad. You're gonna wanna buy some stuff ahead of time, such as Advil or ibuprofen, some kind of anti-inflammatory. If you are okay to take this type of medication, always check with your doctor. But this helps so much when you're in pain. I'm not someone who likes to ever take anything, but it was really worth it. It took the edge off, so I was able to function throughout the day. More floss. When I tell you the first month how much more floss I went through than normal because I was flossing after every single snack, because as a dental hygienist, you never want to put those trays back on your teeth after eating without at least flossing and rinsing with water. I'm aware it's not always easy to brush if you're out and about during the day, but flossing with the floss picks and rinsing with water, it is absolutely necessary. So side note on this, clear aligners, and you know if you've already had them or you have them right now, they really make you struggle with, is that snack really worth it? Since taking them out to eat, then brushing, flossing, what have you, before putting them back in, it sounds like no big deal, but as someone who loves dental hygiene, I started getting very sick of it. So I was barely snacking after a few months of it because it just wasn't worth the whole process of taking them off, brushing, or just flossing and rinsing, doing the whole thing. It became a lot. You don't realize, well, I didn't realize just how much I snacked every single day. Anyway, I've seen firsthand so many of my patients get cavities between their teeth after or during their clear aligner treatment since they weren't practicing proper dental hygiene throughout the day. If you put those trays on your teeth with food still stuck on your teeth, that's trapping bacteria in there. Along with food, you're gonna get cavities. So when I started this journey, I knew, of course, I never wanted that to happen to me. So I was crazy about flossing before ever putting the trays back on my teeth after snacking. I also used the little travel toothbrushes whenever I could, when I was out and about, or else sometimes I did bring an actual toothbrush. It just depended on where I was traveling. Like if I was at work, then the bathroom felt clean enough to do a full brushing session in public versus a concert venue or something, you know? So after snacking and meals throughout the day, floss plus swishing with water equals a must. Floss plus little travel toothbrushes plus swishing equals one step up from that. And the best would be brushing with an actual toothbrush and toothpaste and floss and rinsing. I did what I could when I could. Anyway, back to our list. We got the ibuprofen, we got the travel flossers, the little toothbrushes. Also, you might want to consider making a toothbrushing kit. I bought a cute little tooth bag for myself that I was able to throw in my purse or backpack to take with me to work each day. You're doing this teeth straightening journey for your teeth to look nice in the end. You don't want cavities when you're all done, right? That's the last thing you want. So make sure you have all the tools you need for your daily life. One more side note on the eating topic, the 30-minute rule. It is usually that you're supposed to wait 30 minutes to brush after eating or drinking anything other than water, but that rule is not a rule during your teeth straightening journey. It's more important to brush after every meal and or snack so you can get those trays back on your teeth ASAP, because you're supposed to keep them on your teeth for 22 out of the 24 hours of the day. Maybe your dentist and or orthodontist will tell you differently, but that's what the rule was for me. So I didn't have time to be waiting 30 minutes after every snack, you know? So now let's talk about my first day experience. After I had my initial appointment for the scans to take photos and digital impressions of my teeth, I went in to try on the first set of trays. And I had to have a bunch of buttons placed. These are clear little dots glued to your teeth to help the trays attach to your teeth and move your teeth better. They aren't always needed, but if you're going to need a lot of movement, they are often used. They are just like the glue cement stuff used to stick on the brackets if you have traditional braces, but in this case, they just help snap in your liners. So yeah, the process of putting on the buttons is kind of similar to a filling appointment, but it doesn't hurt at all. You don't need to get numb, nothing like that. They just glue them to your teeth, kind of like tooth gems. They use the little blue light to harden them, cure them onto your teeth, and then you put in your aligners and they send you home. Now, once I got home, my first day experience. Again, I didn't realize the discomfort I would feel, especially the first time removing them. I honestly thought something was wrong because it hurt so bad. It didn't feel right when I took them out for that first time, but I powered through. I got the feel. Removing them from the back side and popping them from back to front worked best for mine, but yikes, did it hurt those first few days. Luckily, I did learn that the first week is the hardest week. It gets better, I promise. Our bodies are amazing and eventually accept the fact that something new lives in our mouth. Also, just because it was super uncomfortable for me doesn't mean it will be for you. I'm just telling you my experience so you aren't blindsided in case you do have a similar experience. Anyway, for me, I had it where every 2 weeks I would get a new set of trays to wear. So that process happened every 2-ish weeks, with the first couple days of the new trays being the worst. And by the time they felt good again, after the 2 weeks of the new tray, I would finally feel great, and then it was time to get a new tray again. Of course. However, my dentist had a hot tip that really helped with the discomfort. She recommended when changing to the new trays each time to put them in at night before bed, because then you'll have less hours awake to be feeling that first day of pain, because time really does make it better. But back to my first day. Okay, I really clearly remember I went to eat cereal, not even thinking much that it would hurt to eat, because I was only thinking my teeth would hurt when the trays were in. But oh no, they hurt even more when the trays were out and I was trying to chew because the teeth were so sore. So another thing to maybe put on your things to buy ahead of time list: soft foods. And I have some categories of soft foods for you. 1, very soft, no chewing type foods like yogurt, plain or flavored, smoothies or protein shakes, applesauce or fruit puree, pudding or custard, mashed potatoes, cream soups, tomato, butternut squash, etc., oatmeal or cream of wheat. Next category, soft chew type foods such as scrambled eggs, macaroni and cheese, ramen or other soft noodles, rice, soft cooked vegetables, carrots, squash, zucchini, soft fruits, bananas, ripe peaches, melon. And lastly, you gotta get yourself some treats like ice cream or frozen yogurt. Cold can also help with soreness, by the way. Milkshakes, gelato or sorbet or sherbet, popsicles, and drink plenty of cool water to help soothe your mouth. Sucking on ice cubes feels so nice, but of course do not chew them. You wouldn't want to anyway, they are way too hard. And yeah, really try to avoid anything crunchy, chewy, or sticky. Nuts, chips, candy, crusty bread to help avoid discomfort. Also, talking was annoying at the start. I did take them out when I filmed my YouTube videos here, but I did keep them in for podcasts and social media, Instagram, TikTok posts. Whenever I was speaking at dental conferences, I kept them in because again, you get used to it. I just didn't want the lights in here to shine all weird because I have a bunch of lights up in this YouTube room here. And lastly, before we go, seriously, I just want to say, don't give up. I almost wanted to give up because of the pain at the beginning. It hurt so bad those first few days, for the first week of the first one, and the first 5-ish days for the second time I got new trays, and less each time, until at the end, it barely bothered me when I would switch trays. They would just feel a little tight. It was really fine. It didn't hurt like that no more. And it really was so worth it in the end. I did it mostly for my lower teeth. I had that one canine that was crooked and it bothered me, and since I do this for a living, I figured let's try it. It's not a huge deal, but I am very happy with my results. It was so worth it, and it will be so worth it for you as well. If you want to learn more about ways to keep your teeth and the trays themselves clean throughout your journey, I'll link those videos of mine below from a dental hygienist perspective versus a patient perspective. Even though I couldn't help myself in this video, I told you a lot about keeping your teeth clean, but it was my experience. I am both a patient and a provider. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth. Straight teeth.